Why is blood pressure measured in mmHg? Imagine trying to measure how hard water pushes against a pipe. You need a reliable way to see how strong that pressure is. That's what blood pressure measurement is all about. Blood pressure tells us how much force blood exerts on the walls of our arteries as the heart pumps. To keep track of this force, doctors and health devices use a unit called millimeters of mercury. This might sound unusual, but it has a simple history. Long ago, the first devices to measure blood pressure used a column of mercury in a glass tube. When the cuff inflates around your arm, it temporarily stops blood flow. As the cuff deflates, the pressure at which blood starts to flow again is noted. The height of the mercury column at that moment shows the pressure. The reason they use millimeters of mercury is because mercury is very dense. This density makes it respond predictably to pressure changes, giving precise readings. The unit millimeters of mercury means the height of a mercury column that the pressure can support. Even though the International System of Units, or C, does not include millimeters of mercury, it remains the standard in medicine. That's because it's been used for so long and is familiar to healthcare providers. It makes readings easy to compare and understand. When you measure your blood pressure at home, the cuff inflates to stop blood flow. As it deflates, the first sound you hear is the systolic pressure, and the point where sounds disappear is the diastolic pressure. Both are recorded in millimeters of mercury. Using the correct cuff size and proper technique is important. A cuff that's too small or too big can give inaccurate readings. Sitting with your back supported and your arm at heart level helps get the most accurate measurement. Knowing why blood pressure is measured in millimeters of mercury helps you understand how these numbers reflected your health. Elevated readings, like over 130 millimeters of mercury systolic or over 80 millimeters of mercury diastolic, mean you might have hypertension. That's why precise measurement is so important for monitoring and prevention. In the end, the use of millimeters of mercury connects us to a long tradition of accurate, consistent measurement. It helps doctors and you keep a close eye on your blood pressure and stay healthy.